Hello and welcome back to Rheuma Talks. So today we will be discussing about an important disease called as SLE, which is Systemic Lupus Erythematosus. So imagine a disease that can mimic almost anything, a disease that might start as a simple fatigue, turn into a mysterious rash, and then suddenly cause joint pain that makes it so hard to even hold a cup of your morning coffee. In the medical world, we call it the Great Imposter, but the real name of this is SLE, which is Systemic Lupus Erythematosus. So, as we are approaching the World Lupus Day, which is on May 10th, we on Rheuma Talks are pulling back the mask. If you or someone you love has been feeling not quite right with symptoms that come and go, this video is just the right video for you. We are breaking down the clinical symptoms of lupus in a way that actually makes sense for everyone, including the common man. Okay, so what is SLE? Lupus is basically a multi-system autoimmune disease that sounds a bit complicated, but think of your immune system like a security team. Their job is to fight off intruders like viruses and bacteria. But in lupus, what happens is your security team gets confused and they start attacking your own healthy tissues, which can be your skin, your joints, your lung, your heart, and even your kidneys. So basically, any system can be involved in SLE. So it is also known for a relapsing and remitting course. This means there are flares where you feel terrible, followed by remission where you feel better with medications. Because it can hit any part of the body, no two people with lupus have the same experience. It's as unique as a fingerprint, which is each lupus patient behaves completely different from the other. Okay, so now let's come to the big three common symptoms that lupus patients face. Statistically speaking, there are three major signs that show up in almost 80 to 90% of people with lupus. That's what I call it as the big three. So these are basically your constitutional symptoms, the mucocutaneous manifestations, and the arthritis. So these are what I call it as the big three common symptoms because it is seen in nearly 80 to 90% of the people. Okay. Now what is this constitutional flu kind of a symptom? Okay. Imagine having a flu that never leaves your body and you continue to experience symptoms of fatigue, low grade fever, unexplained weight loss, malaise. These are called your constitutional symptoms. Okay. Next, we have mucocutaneous manifestations, which can be your butterfly rash, which is the classical famous rash or the famous sign that has been described in lupus. Okay. It usually spares the nasolabial fold. Okay. The rash mimics exactly like a butterfly. Okay. Then we have arthritis, which is nothing but your joint pain, stiffness, and swelling. Okay. So it affects your small joints as well as the large joints, and it's usually the joint pain is worse in the morning where you have stiffness of your joints. That's when you find it difficult. When you wake up in the morning, you feel that your joints are stiff, you're unable to make a fist, and after 30 minutes or 45 minutes or after 1 hour, you feel that the joints are getting loosened up a bit. So this is the classical pain that is described for a arthritis. Okay. Next, coming to the skin. Okay, lupus just doesn't stop at the skin, as I already mentioned. Okay, it can involve any other organ of your body. Okay, now the classically described lupus rash is a photosensitive rash. Okay, it's important to know that exposure to sun can actually trigger a lupus flare. Okay, so many people are not aware of this, so it is very important to understand that photosensitivity is an important symptom of lupus. Okay, many patients get a skin reaction or a rash just within a few minutes of exposure to the sun. Okay, next is your mouth ulcers. Okay, these are not your typical burnt my tongue kind of mouth ulcer or your aphthous ulcer. Okay, they are usually painless ulcers which is located on the palate. Okay, that is your hard palate of your mouth and even in the nose also. Okay, then patients tend to have hair loss, which is described in medical term as alopecia. Okay, they can also have thinning of hair, lupus hair. Okay, then scarring alopecia can also occur. Then non-scarring alopecia can also occur. Okay, then other symptom is your chest pain can happen in lupus because there can be inflammation of the covering of your heart. Okay, this is called as serositis. Okay, sometimes there can be inflammation of the covering affecting your lung. Okay, this is also called as serositis, for example. Okay, this is if it affects the lung covering, it is called as pleuritis. If it affects the covering of your heart, it is called as pericarditis. Okay, then next we are coming to a very serious organ involvement, that is renal involvement, that is your kidney involvement. Okay, so this is called lupus nephritis. It is important to know that around 40 to 60% of patients with SLE will have kidney involvement. The scary part is you often will not know that your kidney is affected by lupus nephritis unless patient is having a end stage renal disease. Okay, so this is why visiting a rheumatologist is very important to screen for involvement of your kidney, that is your lupus nephritis. Okay, so some subtle symptoms which you may notice, like for example your foamy or a frothy urine, okay, or swelling in your legs and ankles, it is a major red flag that needs immediate attention from a rheumatologist, because sometimes the symptoms of renal involvement may not be there at all. Okay, it is only when routine testing and regular screening for lupus nephritis that we come to know that your kidneys are affected by lupus nephritis. So it is very important to consult your rheumatologist regarding involvement of your kidneys. Okay, the next we are coming to is your respiratory system. As I already mentioned, any organ can be involved. One of the organ is your lungs. Okay, then what we observe is pleuritis. Okay, pleuritis is a common lung issue which happens in around 50% of patients with lupus. Okay, that will, what are the symptoms that patients can have? Okay, they can have a sharp pricking type of chest pain when they take a deep breath. So this gives us a clue that yes, probably patient is having serositis, which is your pleuritis. Okay, then also there can be serious lung complications like your lupus pneumonitis. Okay, which mimics a severe pneumonia. Then there can also be DAH. DAH is your diffuse alveolar hemorrhage, where patients will have bleeding into the lungs. These are all true medical emergencies where patient requires immediate medical care from an expert rheumatologist. Okay, then we have something called as a shrinking lung syndrome. It's a little unique feature where the lung volumes actually decrease, making it hard to take full breath. It's a type of restrictive type of lung disease, but the lung tissue itself may appear normal on a CT scan or a chest X-ray. Okay, but when we assess the lung functions using a spirometer, okay, then we know that patient's lung volume has reduced. So this will, and patient will have unexplained breathlessness, which is not explained by any other disease. Patient will just be breathless, and when you are checking for lung function, you can find that patient is having a restrictive pattern on the of FVC on spirometry. Okay, next is never forget the heart. Okay, cardiac involvement is also very common in SLE, which can happen in 40 to 50% of patients. Okay, the commonest one being your serositis, which I already mentioned. The, in other words, it is a pericarditis. Okay, so that is, the pericardium is basically the covering of your heart, which can get inflamed, and patients will tend to have chest pain. Okay, this is called as pericarditis. Okay, then there is something called Libman-Sachs endocarditis, where it's a type of valvular disease where there are small vegetations that are formed on the valves. Okay, usually it is associated with the antiphospholipid antibodies also. Okay, then SLE patients have a very high risk of having a heart attack. I would say it's approximately 50 times higher for having a heart attack in a lupus patient compared to general population. Okay, this is probably due to accelerated atherosclerosis, which happens in patients who are suffering from lupus. So it is very important to screen for cardiac involvement using a ECG or a echo. Okay, sometimes an expert cardiologist opinion also may be required for these cases. Let's not forget about neurological involvement. We have a set of 19 different syndromes which come into something called NPSLE, which is your neuropsychiatric lupus. This covers a broad range of around 19 different syndromes. It can range from a simple brain fog like confusion, cognitive dysfunction, and migraines to severe symptoms like your seizures, stroke, or even psychosis. Okay, then your gastrointestinal tract can also be involved. It is less talked about, but actually it's actually very common than you expect. It's around 30 to 40% of patients with lupus. They do have some form of gastrointestinal tract involvement also. Okay, rarely it can cause serious issues like mesenteric vasculitis, where there is inflammation of blood vessels in your gut. So they can have come with severe GI pain. Okay, and they can have gangrene of the bowel wall. Okay, so this is a very dangerous complication. Sometimes they can come with even pancreatitis also. Okay, then also lupus hepatitis is also a known entity which can be associated with lupus. Okay, then let's not forget about the blood. There is hemoglobin, that which is your RBCs, that is your red blood cells, then your white blood cells and your platelets. So all these three cell lines can be involved, which is often grouped together as hematological involvement in lupus. So anemia is often very common. Okay, usually can be caused by anemia of chronic disease. Okay, or they can have associated iron deficiency anemia. Then they can also have something called autoimmune hemolytic anemia, where the immune system attacks your own body's red blood cells and kills this red blood cells. Okay, then white blood cells, how they can be affected is you can have a low white blood cell counts, that is leukopenia. Specifically speaking, you will have lymphopenia, that is low lymphocyte counts. Okay, then platelets can also be affected. Okay, this is called as thrombocytopenia, which is often a sign that the disease is active. Okay, then you can also have enlargement of your lymph nodes also. Okay, it can be your cervical lymph nodes or your abdominal lymph nodes. Okay, or lymph nodes in your thorax also. Okay, so these are the various organs which can be affected in lupus. Okay, so it is very important to actually consult a rheumatologist for examination and evaluation of various organ system involvement in patients with lupus especially. Okay, it's basically a multi-system disease. Okay, so overall, just to tell you that yes, lupus is a very tough disease. It's a very tough opponent, but it's the one that we can manage as rheumatologists because we are well qualified to manage this kind of diseases. If you recognized yourself or a friend fitting into any of these symptoms, please don't panic. Please do get it checked because early treatment makes a world of difference for patients who are suffering from lupus. So, coming to my conclusion, I would just like to tell you that we are reaching towards the World Lupus Day, which is May 10th. So, I just made this video to spread awareness so that no one has to fight the great imposter alone. So we are there to help you out. Don't forget to like and subscribe to Rheuma Talks for more medical breakdowns, and please share this video. It might be the sign someone is looking for. So stay healthy and I will see you in the next video.